Well, let's face it, how we look on the outside, it really could affect how we feel on the inside. And sometimes just fixing that little bump on our nose, well, it could make all the difference. Trust me on this. Dr. Patty Flint, board-certified plastic surgeon, she joins us today to tell us more about rhinoplasty, or what I like to call a nose job. That's how we really know it, right?
Truly.
All right, so is it a popular procedure?
It really is. It usually ranks in the top 5 nationally when the statistics are published.
And who do you think makes a good candidate for this?
I think people that come in are very specific about what they don't like about their nose, and I tend to agree with what they're telling me. I feel confident that we can make that better for them.
And I'm sure it's come a long way. I mean, I've sort of put it out there already. When I was younger, had a big old bump on my nose. I fixed it. It raised my self-confidence way high. I'm sure it's come a long way. What is the procedure like now?
It's really extremely well tolerated and with a quick recovery. We do it under general anesthesia, so there's no awareness, and it is done as an outpatient. It takes about 2 hours.
Wow.
And these days it's rare to use packing inside the nose.
Thank goodness.
Yeah, that was the hardest part in the past, but we really don't use that commonly these days. So usually within about 10 days people feel comfortable socializing, and it really comes with very little discomfort following the procedure.
And I would think that the black and blue, I mean, you're going to get it, but maybe not as much as like if your mom had it, you know, 15, 20 years ago.
Well, and it really depends on what technique needs to be done. If we're actually moving the nasal bone, then bruising is more common, but in many patients that's not necessary, and we really don't see much bruising.
Well, let's go ahead and look at some before and after pictures, because I'm sure you'll all agree, before and after, you can see why it makes a world of difference to these patients. Go ahead and tell us what we're looking at here.
This woman is in business for herself and had never really liked her nose, but was very directive that she wanted a subtle change. She did not want to look different to clients, friends, and family, so just a slightly smaller nose was all she was after.
And the side profile, I think, is where you really see it. And it just looks like the bridge of the nose is what you did?
Exactly, and we slightly changed the angle of her tip to upwardly rotate it just a little bit. I strongly prefer natural appearing results, and consequently I don't like overdone pinch tips and things like that, but she was exceedingly pleased with this very subtle result.
Right, it looks beautiful, and you're right, it is really, really subtle, so I'm sure she was really happy with it.
She was.
Okay, and then we have another patient we'll go ahead and look at. And this woman, when you get to her profile shot, you'll really be able to tell. What did you do here?
She really complained, and we'll see in a moment, about a very prominent bony hump on her nose in profile. She would avoid allowing her picture taken in that position, and she really just wanted that trimmed down, and she was also extremely happy with the result.
Yeah, you could see it a little bit there, but you really see it in this third picture. That was my nose. It looked like a parakeet, a parrot nose. That's
it looks great now.
Yeah, beautiful. All right, well, those before and afters, they really sum it up. So let's go ahead and tell everybody how they can meet with you. Dr. Patty Flint is accepting new patients, and if you would like to reach out to her, you can call her at 877-91-FLINT or go to pattyflintmd.com. She has 2 Valley locations, one up in Scottsdale and the other one right there in Dobson, or actually in Mesa on Dobson. And again, we will have all of the information on our website.